Hi everyone, my name is Christy Pennebaker and my presentation will be about holistic care with an increased focus on preventative medicine. At the end of the presentation, the learner will be able to do the following: identify the primary focus of holistic health and preventative medicine, identify how preventative medicine impacts healthcare and society, and discuss implications of holistic healthcare and preventative medicine. What is holistic health and preventative medicine? Holistic means that something is approached from a mind and body perspective. Holistic healthcare is an integrated approach to healthcare that treats the whole person, not simply symptoms and disease. Mind and body are integrated and inseparable. Holistic nursing prioritizes providing care that is aimed at healing the whole person, that is, the patient's mind, body, and spirit. Promoting lifetime wellness and health is a key objective of holistic nursing. Preventative medicine encompasses both the care of the individual patients and public health practices. The focus is the prevention of the disease rather than the treatment. It promotes building good habits that make a healthy lifestyle much easier to obtain, but more importantly, to maintain. Preventative medicine seeks to enhance the lives of individuals by helping to improve their own health and by promoting health and wellness in the community. Influence on nursing practice. Florence Nightingale was the founder of holistic nursing. Nightingale taught nurses to focus on the principles of holism, which is unity, wellness, and the interrelationship of human beings and their environment. Holistic nurses value each person's physical, mental, emotional, spiritual, and environmental strengths and challenges. Holistic nurses work in all healthcare settings and assist to facilitate birth, growth, recovery, or end-of-life transition. As we all know, failure to care for yourself reduces the ability to care for others. We need to remember that self-care is very important in this field. Through preventative medicine, nursing professionals provide their patients with the means to maintain optimal health and wellness. The impact on healthcare. Preventative medicine impacts healthcare by improving patient outcomes. It also remedies ailments prior to waiting for symptoms to surface. Real health is achieved with treatment of causes rather than symptoms, and a decrease in chronic health issues. An example being when we provide the proper education on nutrition and diet, this can potentially prevent life-threatening chronic conditions. Patient education includes healthy eating habits, sleeping properly, regular exercise, and avoiding adverse substance use such as tobacco, alcohol, and drug use. There are many people suffering from multiple comorbidities, many being preventable. We see an overwhelming number of people coming into the emergency department, hospital admissions, and doctor's offices, which leads to overworked and understaffed facilities, which in turn results in decline in the quality of care given, and in return we will see poor patient outcomes. Preventative medicine benefits society by reducing the risk of chronic disease by promoting healthy lifestyle changes. We will also see a decrease in the number of hospital admissions and doctor visits, and also a decrease in medical expenses. And some guiding principles according to the American Holistic Nursing Association. Fostering dissent without contempt allows for greater opportunities to enlarge and enhance understandings and appropriate actions. Generating a well-imagined future that fosters transformative change. A world in which healthcare is grounded in wholeness, focused on strengths rather than disease, and promotes self-determination of people. The World Health Organization recommends public health awareness of a healthy lifestyle as a best buy to improve patient outcomes. And in conclusion, people have always called upon nurses to be there for them in ways that are responsive to their ever-evolving needs and concerns in relation to their health and well-being. Each person is responsible for his or her own health, But we need to remember, as nurses, we are responsible to provide education, to assist people to live the best life that they can. Real health is not just the absence of disease, but a positive state of being. I feel like with the focus on mind, body, and spirit of holistic medicine, many people will find themselves in a positive state of being. Thank you for viewing my presentation.